progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
During the past several years, much has been written about a preparation called Platelet-Rich plasma, or PRP, and its potential effectiveness in the treatment of injuries. Many famous athletes have received PRP for various problems, such as sprained knees and chronic tendon injuries. These types of conditions have typically been treated with medications, physical therapy, or even surgery. But some athletes, however, have credited PRP with their being able to return more quickly to competition. My guest today is Dr. Katayoun Motlagh. She's board-certified family practice physician and a member of the medical staff at Palmdale Regional Medical Center. Welcome to the show, Dr. Motlagh. What is PRP, platelet-rich plasma? What is this?
Hello, thank you for inviting me to the Radio MD. PRP stands for platelet-rich plasma. Basically, blood has multiple components. One of the components is platelets, which act like growth factors and stem cells. It helps in a lot of different ways to help heal different part of the body and injuries. So that's what platelet-rich plasma stands for.
So which conditions benefit most from PRP? What conditions can it treat?
There are so many different things that can benefit from treatment of PRP. Most commonly, it's used in orthopedic fields like tendonitis, arthritis, like joint diseases, injuries during the sports, but it's also used in cosmetic fields for restoration of hair, for people who have hair loss for different reasons. In females and males, it's used in rejuvenation of skin for, improvement of wrinkling, volume loss, saggy skin. Used in acne scarring or any kind of scarrings, even after surgeries, like people who make keloids. Keloids are thickening of the skin after procedures, and they stand out really strong on the skin and takes a lot of attention, so they can be treated to milden and soften the appearance of the skin. The acne scars can have a lot of pits and formation, and they can make new collagen and flatten the pits in the skin, so it gives you a smoother looking skin. It's used in neurosurgery. It's used in cancer treatments. It's used in even sleep studies or sleep medicine. I've talked to ear, nose, and doctors or surgeons who are actually involved in researches and shown that they have injected this to the throat, and it helps them to lift the back of the throat to help with sleep apneas. Even for after surgeries to improve scar and healing and having better outcomes has been done post-surgically. But a lot of times it's done before even surgery would be an option.
So, Dr. Motlagh, it sometimes has been touted as a natural treatment because it's your own blood being returned to you. So tell us a little bit about the science of platelets, how they are being seen now as a healer. And is this along the lines, is this considered medicational intervention? Speak a little bit about the science of it.
So it is natural because it's a patient's or person's own blood. You can never use somebody's blood for somebody else's. It has to be used for the same person. So since this is taken from the same person's blood, and it's a component of the blood, not the whole thing, going back to their body in different sites, it's usually, not usually, I would say, it's, as my experience, never have had any problems or there's no medication involved, so there's no possibility of reaction or allergic reaction to the treatment. It's actually because of this growth factor healing process, this chance of having people getting even infections are very minimal because this is actually good for infections. As far as platelets are derived from growth factors. So one of the work of platelets are cell growth, new generations, and repair of blood vessels. Other works that platelets can do is they work as a vascular endothelial growth factor. So basically the lining inside the blood vessels, and can promote regeneration of that little cell. So you can think about it as if you have a new cell, new generation of something very new, like a new baby, and it has to grow again, and it age again. So if you have a new cell, new growth, like a stem cell that works in different part of your body and improving or generating new cells to age again, that's basically how growth factors or the platelets work. Is this something that can be used as new medicine? It's in a process of a lot of research. There are a lot of, I would say, very awesome outcomes coming out. Whether they're FDA approved or they're going to now accept it in medicine completely, that's in the future, I guess. But the fact that it's safe, nothing goes wrong with it. It helped people to make a decision to do these treatments and actually see their awesome results.
So tell us about the injections themselves. How are they administered, and how often would someone need to have this done to feel results?
So basically, we separate the platelets from the whole blood in a way of high centrifuge and speed. And when we get the platelets separated, we inject them back to where it's needed. So it depends if it's a joint, it goes into like one injection. If it's like for hair growth, it might be involving like hundreds of injections, but in different where the hair follicles are. If it's in the face, it could be hundreds of injections into the face. Obviously, these patients are numb. There's really no pain. With the treatments, the needles are very small, very, very, very well tolerated. I actually have done them myself with no medications, very well tolerated. But it depends where you're aiming at. Again, it could be if it's treating knee arthritis, so you just involves one long needle injection, like any other knee injections, like if somebody wanted to have a steroid injection to the joint. But again, for the face or the hair would be very small needles, very superficial. For acne scars would be very superficial injections. But we use topicals, numbing medications, or even oral medications and then patients usually tolerate them really well. So
how many sessions would somebody need to feel results?
Everybody's different. I think it depends on the injury or the type of treatments they're receiving. I would say that with one treatment, you see a very good result within 3 weeks to 3 months. I usually tell my patients what you see at 3 months is actually what you really get. After that, if you feel like you need more treatments, then you have to get another one at 3 months. So I can't give you a percentage, but I've had, let's say, talk about hair growth and, for baldness. I've seen hair growth within 3 weeks. I've seen improvement of the pain and the tendonitis within 2 to 3 weeks. Usually 3 weeks is the average time for seeing results. I could say confirm that.
In summary, doctor, what would you like to tell people who are suffering from chronic tendon injuries, acute ligament or muscle injuries, knee arthritis, or any of the conditions that you mentioned about platelet-rich plasma and what they should consider if they would like to look into this type of treatment?
I would suggest that people should actually think about PRP as a first-line treatment after exhausting maybe a physical therapy or a medication for a short time, not long term. If they have the capability of doing it even sooner, it would be even better to heal faster than even going through physical therapy. It's a natural way of treating your joints, and it usually there's no side effects to it. So they're not going to they're not going to lose anything. It would be the very best treatment first before any surgery considered. But if they're one of those patients that they do have to have surgery and they're not a good candidate for PRP first, and again, it's different case by case, but it would actually also benefit them after surgery, because when they're healing, they prevent scar formation, and actually the outcome of surgery could be better. So I highly recommend PRP. I'm very passionate about it. I've seen awesome results. I have a lot of before and after pictures on my website if people like to see the actual patients, not just website pictures. They're welcome to look at it or ask questions. I'm happy to answer all those questions.
Thank you so much, Doctor, for being with us today. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Individual results may vary. There are risks associated with any procedure. Speak with your physician about these risks to find out if this procedure is right for you. This is Melanie Cole. Thanks so much for listening.